Hello guys, so today we shall be discussing what is bleeding time and what is clotting time, which you generally call it as BT and CT time. So bleeding time and clotting time are the two procedures, right? So you assess these procedures just before performing the surgery, because all of you know that during the surgery there will be a considerable amount of blood loss. So bleeding time and clotting time, we assess these two timings to know if the patient is having any kind of blood disorder. Why? Because during the surgery there will be a considerable amount of blood loss, and if the patient is having excessive bleeding time or excessive clotting time, then the doctor cannot maintain hemostasis for the patient. So this leads to hypovolemia, this leads to lots of blood loss, and that will lead to hypovolemia and shock, and finally the patient might die. So that is the reason why every anesthetist before the surgery they need to do a pre-anesthetic evaluation, which you also called as PAC evaluation. So in that PAC evaluation you basically look at the bleeding time and the clotting time, basically find whether the bleeding time is within the normal limit or not and the clotting time is within the normal limit or not. So first of all we are discussing about the bleeding time now, and then later on we shall discuss what is clotting time. So in the bleeding time, what do we assess? Why do we do the bleeding time for? Bleeding time is, we use bleeding time to assess the platelets. For example, if the platelets are low, it means thrombocytopenia. In that case, the bleeding will continue, and that will lead to increased bleeding time. For example, if platelets are enough in your blood, right? If the platelets are in a normal value in your blood, so what will happen? The platelets will form platelet plug, that leads to stoppage of the bleeding or hemostasis. So bleeding time is mainly used to assess the platelets, right? For the proper assessment of the platelets. So what is a procedure? First of all, let me explain you the procedure, and later on I'll show you how is it exactly done, right? So what you do is that you explain the complete procedure to the patient, and now you prick the finger of the patient. After pricking, the moment you prick the finger of the patient, start the timer, stopwatch. Now what you do is, you add a drop of blood at 00 seconds. Wait for 30 seconds and then add a next drop of blood at 30 seconds. Wait for 30 more seconds and add the next drop of blood at 60 seconds. So in this way, after every 30-second interval, you keep adding blood. Till when you should add the blood? You should add the blood till there is no drop of blood coming out of the patient's finger or the patient's prick point. Then immediately stop the timer and note down the value. So that will be the bleeding time. And I am telling you, the normal bleeding time is around 2 to 7 minutes, which means if the value is between 2 to 7 minutes, the platelets are under normal number. For example, if the bleeding time is more than 7 minutes, it means the bleeding is still continuing, which even means that the platelets are deficient in the patient's body, and that is the reason why there is delay in the platelet plug formation. So now let us start the procedure. Having explained the procedure, you even have to explain the complete procedure to the patient. Now after explaining the procedure to the patient, now take the patient's finger. Now completely clean this area from the center to the periphery. So you have to sterilize this area for about 30 seconds. Now take the short needle. Now prick the patient's finger. Now the moment you prick the patient's finger, the moment you see the blood coming out of the finger, you have to start the timer. So now I am pricking the patient's finger. Now I am starting the timer. Now the patient will place his first drop of blood at 0 seconds. Now patient has to wait till 30 seconds to place his next drop of blood at 30 seconds. Now patient is about to place his second drop of blood at 30 seconds. Now patient will place the next drop of blood at 60 seconds. Now patient will place the next drop of blood at 90 seconds. Patient will place the next drop of blood at 120 seconds. As you can see, the blood is decreasing slowly. The amount of blood coming out of the patient's finger is decreasing. As you can see, from 0 seconds to 120 seconds, gradually the amount of blood is decreasing, which means that the platelets are forming a plug there. This is called as platelet plug. Now the patient will place his drop of blood at 150 seconds. Now patient will place his next drop of blood at 180 seconds. Right. Now I am stopping the timer. As you can see, gradually the amount of blood from 0 seconds all the way till 150 seconds is gradually decreasing, and there is no drop of blood at 180 seconds, which means it took 3 minutes 2 seconds for the patient to form, for the platelets of this patient to form a platelet plug. So this is called as a bleeding time. So the normal bleeding time is between 2 to 7 minutes, and this patient had a bleeding time of 3 minutes 2 seconds, which is absolutely normal. So from this we can infer that the patient is having normal number of platelets in his body, performing normal platelet function.